Hi class, my name is Kendall. I'm going to be talking about my interview with Dr. G. She owns a clinical practice. She's not only a mental clinical health therapist, but she also holds other degrees in nursing um, as her doctorate in psychology. So she has a little bit of a verse background compared to maybe some just clinical mental health counselors, but I still thought she was a really great person to interview. And when we talked about professional identity, she spoke about kind of the differences between her being a clinical mental health counselor and then the psychiatric side. And so, as a clinical mental health counselor, she uses a lot more of the cognitive theory when talking to her clients on helping them overcome those different thought patterns. She also uses hypnosis, which is a tactic to kind of go into the minds of her clients and help them to release those traumatic moments or those stressors that they might be feeling if it's like a deeper thing. And then as a doctor in psychology, she is able to give the medicine and diagnose and treat people that may be dealing or suffering with more higher levels of mental health related challenges. And so she identifies herself in a little bit different way than maybe the normal clinical mental health counselor. But overall, she spoke a lot about her ethical clients' relationships and how important that is to keeping them very professional and not too personal, so that way they can keep the thing. And also, I experienced with her a time where she did take time away for herself so that she wouldn't be a hindrance to her client. And she was away for a couple of weeks, and when she came back, she was much better, and she just shared her deepest apologies, and it was the right steps she needed to take to make sure that she was keeping a good professional relationship. Um, the next thing. Oh, so then what she talks about was the most rewarding part of being a counselor and what's the most difficult. The most rewarding is definitely her being able to help her clients overcome things that they may have been struggling with for years and giving them that space that they need to be their best selves. And then it can be very difficult, she said, for taking on different like the different emotions and the sadness, because as an empath, like, she takes those things on like anyone else would. She like I mentioned, she does use cognitive theory in helping treat her patients. She also uses hypnosis. And some words of wisdom for future clinical mental health counselors is just to be yourself. She always encourages us, and she spoke to be yourself and to not be afraid to keep trying to include yourself in the process of the work that you are doing, because you want to be authentic. You want the clients to know that they're safe, and you want the clients to know that they can talk and that they do have a voice and that they have the answers. They have the power. They are in control. And so when you give it to God, may his work be may your work be a glory to him. So thank you.